what the opioid epidemic did was create a new population of opioid addicted folks, Americans, all across the country, because it was promulgated by pharmaceutical companies who pressuring doctors to prescribe, and doctors were all over the country, and doctors all over the country bought into the idea that they could now prescribe narcotic painkillers, morphine, but also branded ones, Vicodin, Percocet, of course, oxycontin, without any risk of running of addiction for those folks who were pain patients. This idea was not supported by science, but nevertheless was essentially accepted, taught in medical schools, et cetera. And so over about a 20-year, 15 to so year period, we saw this enormous increase in supply all across the country from prescriptions, from doctors prescribing to people. And then, of course, a lot of that leaked out into the black market, and you found black market for pills in pretty much every region of the country. They were expensive on the street, $1 a milligram. Usually folks were up to that point by doing 150, 200 milligrams a day. They couldn't sustain that. And when they did, they switched to heroin. And when they did that, the Mexican trafficking world, which had really ignored heroin for a long time, sat up and took notice and began trafficking that. That population has existed, continues, and continues actually to grow. And that population is really probably the first driver of the folks who are using fentanyl. And the reason traffickers in Mexico figured out fentanyl was they saw, gee, this is a growing population. It's so much cheaper, easier, less risk. We don't need land to make synthetic drugs like fentanyl instead of growing poppies, that kind of thing. And so that's kind of what led us into the fentanyl issue that we're dealing with today, and the methamphetamine as well. Yeah.
So what was the difference that you really saw when your book Dreamland came out in 2015? And fentanyl is just everywhere now. I mean, right. How stark was it when in comparing your research for your first book with your current book?
Well, it's a radically different scene. What is the same, though, is an interesting thing, that the supply of drugs is almost comparable. And with the pharmaceuticals, painkillers, you saw just an amazing coverage. West Coast to East Coast, really intensely in some states, certainly, particularly in the Midwest and Maine, New Mexico, Oregon, various places like that. But nevertheless, you found them all over the country. And now we've seen the underworld take over that role. The doctors have stepped back, pharmaceutical companies are chastened, and you're not seeing the heavy promotion, sales force promotion that you used to see for narcotic painkillers, and doctors' offices is nearly as much as you used to, barely at all, I think. And so now, but we opened that Pandora's box. We created that consumer market with that enormous supply of pills. And then the underworld stepped in. And when they did, they made a transition. They were already in the middle of, but they really with a vengeance, again, switching from plant-based drugs, which the Mexican trafficking world had grown up on, marijuana and poppies, et cetera, away from that really towards synthetics, and the main ones being fentanyl and methamphetamine now. So it's a fascinating switch, because there's a totally different source for what we see on the streets today, but the coverage is remarkably similar, so complete, on the entire country. Something we've never really seen before is a homogenization of the drug offering all across the country, very much like what you see when you go across country, drive across country on the interstates. You see the same hotels, the same Burger Kings and McDonald's, the same gas stations, et cetera, et cetera. It's almost like they mimic corporate America in that, and that the same offering in New Mexico as in LA, as in Vermont, as in Columbus, Ohio.
And that's got to be, I guess, that's connected to the synthetic nature of it, right? I mean, let's talk a little bit about how, you touched on it there, but what I found so fascinating in your book was how the synthetic nature of these drugs changed the supply chain as well. And then, of course, it makes it a lot easier to spread because the quantities are so small and so easily smuggable, particularly in fentanyl's case. But meth's always been synthetic, but the fact that there is this infrastructure for synthetic drug use probably allows for greater meth sales as well.
Yeah, the synthetic thing allows for the supplies that we're seeing today. So with synthetic drugs, you no longer need land. You no longer need rainfall, seasons, a large cadre of farm workers and harvesters and all that stuff. All you really need, you don't need land. What you need is shipping ports. And there are two shipping ports that are very important in the story on the western side of Mexico, Pacific coast, and near the drug producing regions, Sinaloa, Michoacan, those areas, and the chemicals. So shipping ports allow you access to the world chemical markets, and those chemicals have been coming in really in like container load quantities for several years now. Synthetic drugs also allow you to avoid seasons. The reason we've never seen this kind of supply before from, say, cocaine, really, or marijuana, for example, is that these things take a long time to grow. These plants take a long time to grow and they require certain seasons. With meth and fentanyl, you can make them all year round so long as you have the chemicals, which they do, and so seasons no longer matter. Again, as I say, all they really need are these chemicals. And what we're seeing now is just a result of that. It's like stunning, staggering quantities of this stuff coming through the ports into Mexico, and then from Mexico, it's made into the dope, and it's coming across into the United States and changing a lot about drug trafficking now. It's a remarkable all the different ways that you're seeing. It's really democratized drug, certainly fentanyl. Now anybody can be a kingpin. Right? Yeah. Used to be that you needed that if you were a drug dealer on the street, one of your main concerns was, where am I going to get my dope? And people were always being arrested, sent to jail. You lose your connection, that kind of thing. That has been solved. The supply problem solves the dealer's main issue about where am I going. Now the big issue is, where do I sell all this stuff that I can get my hands on constantly all around me? OxyContin, without any risk of running of addiction for those folks who were pain patients. This idea